things like this. Yeah, but if you saw a value for Pegasus, then we can discuss this after the webinar.
Perfect. So Neil, I'm going to start just so the guests can start to join. So I'll be on mute. If anyone needs any support, just type in the chat and I'll be able to help.
So I see some people trickling in, but I'm hoping that because it's 6:02, we can get started just in the interest of preserving as much time as we can for discussion. Welcome, everyone. I think we have most people joining us. Thanks so much for being with us tonight. My name is Ariane Cohen. I'm a second-year family medicine resident at McMaster. Myself and my two co-moderators, Sophia Charney and Itai Malkin, have been involved with Pegasus Institute for the past few months, helping to organize this wonderful event. Itai and I are both involved locally in green initiatives through the Hamilton Family Health team, and have a lot of interest in sustainable initiatives. Sophia, who will be one of the main moderators for the night, has worked as a teacher for adults for almost 5 years. She taught careers, co-op, and health courses, and she's a passionate environmentalist that was named one of Canada's top 25 under 25 environmentalists in 2018. We're so thrilled to be here with some of the most amazing leaders in sustainability across the country to hopefully turn some thought into action. But before we introduce the speakers, we just want to acknowledge that each of us is on the traditional territory of many nations across Turtle Island. We broadcast mainly from Toronto, the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, it's home to many diverse First Nations, Inuit, and Métis people. We offer this acknowledgement as a stepping stone towards honoring the original occupants, a testimony to the oppression faced by Indigenous people, and our commitment to creating dialogues aimed at addressing such systemic injustice. This is especially important in light of tomorrow's national commemoration of truth and reconciliation, but also for the environmental work which we are all dedicated. We honor today the intimate relationship Indigenous peoples have to this land and our duty to protect it. I will pass it on to Itai to introduce our guest speakers.
Thank you, Ariane. Hi, everyone. Super excited to see you. I'm going to post the link to our main event, this website. I'm going to introduce our lovely speakers. I'm going to give you some idea about their bio, but their full bio with gorgeous photos are available on the website. First, we have Dr. Edward Sheye. He's an emergency physician and a clinical assistant professor at the Department of Family and Community Medicine in the University of Toronto. Among many committees, Edward is also a fellow of the Center for Sustainable Health Systems. Samantha Hurd is a first-year mechanical engineering student representing our non-healthcare field today. She found many platforms to explore her passion for the environment, and that includes the Ontario Nature Youth Council to help promote awareness for sustaining the natural environment. Owen Lowe is a medical student at McGill University, and he currently acts as the co-chair of the Canadian Federation of Medical Students Health and Environment Adaptive Response Task Force. It is a mouthful, but it is known as HEART, and it is a lovely committee. And he's also the founder and co-director of Project Green Healthcare, or Projet Vers la Santé. Linda Varengu. Linda has been empowering healthcare facilities to improve environmental stewardship since the 1980s. She led the Canadian Coalition for Green Healthcare as the founding executive director, and then stepped aside to focus on climate emergency as a senior advisor in climate change. We also have today Tatiana Gajowski. She is a graduate of McMaster's Arts and Science and Anthropology programs. She joined the Hamilton Family Health Team's Green Initiative as a co-op student in January 2021. She now serves as the project coordinator, and that's how we met, collaborating to make Hamilton's primary care just a little bit greener. And we also have Dr. Colin Su-Chu-Lam. Thank you for joining us today. He's a resident physician as well as a doctoral student in clinical epidemiology at the University of Toronto. He is an active member of the Canadian Association of Physicians for the Environment, which is known as CAPE, in the Ontario chapter, as long as many other committees, including Emerging Leaders for the Environmental Sustainability in Healthcare, ELISH, and the Institute of Health Policy Management and Evaluation at the University of Toronto. Thank you so much for joining us, everyone. I'm very excited for the conversation today.
Thank you, Itai. And we also welcome the founder of the Pegasus Institute, Dr. Neil Arya, who is in the audience with us today. The Pegasus Institute is a multifaceted organization that was born from a conference with the vision to promote equity, justice, and global health in its nexus with peace and environmental sustainability through interactive fora to share research, education, field experiences, advocacy, and policy. They are hosting a series of roundtables, virtual event series to reflect on some of the most challenging issues of our time and to discuss potential solutions. The next 60 minutes will be dedicated to a discussion on sustainability. Speakers can jump in at any time, and this is meant to be a back and forth. I want to encourage everyone to join the conversation, and we want to make this as engaging and interactive as possible. So audience members can ask questions at any time using the Q&A feature at the bottom of your Zoom screen, and we will have a dedicated Q&A period at the end. And you can also highlight questions by clicking the thumb icon to ensure that we get the most pressing questions. So let us start. So we can start by asking, what motivated you to take action towards sustainability? Would Edward like to begin?
Yeah, sure. I don't have a particularly deep answer for this question. It was simply recognizing the reality of how climate change and other associated environmental degradation was going to affect us living now and people in our future, and also how inequitable the effects of climate change would be, both around the world and also within Canada here as well.
Thank you so much. Maybe Colin?
Yeah, I mean, that kind of says it all. You know, I would probably summarize it just as sort of realizing the sort of scale of violence that climate change and ecological degradation and the causes of that are wrapped up in, and sort of realizing that not only is there a ton of violence involved, that action now means a lot for not only now but down the road, because a lot of the changes we're talking about are irreversible on a sort of time scale that's relevant to most of us and our families.
Absolutely. Great points. Let's see, Sam.
Well, I guess my answer probably has overlap, but that makes sense given that we're all kind of interested in the same topic. But I mean, when you do learn about the statistics and the reality of what climate change will bring on to the future, like, I think it's just in our human nature to want to fight back against that, because when we see natural disasters in the news and pandemics, everything that makes global news and captures our attention, and we know how much loss and devastation that brings. It doesn't take much to learn that climate change is going to multiply all of these events by tenfold. So I feel like if you're like a human with a basic sense of empathy and caring for others, that it has to be something important to you and you want to try to do something. So I guess we've all found our way here via our different actions. So yeah.
I think to that
Absolutely.
point, too, what's motivated me is just my own awareness of what's been happening, but it's so shocking to me when I talk to people and they don't have that same awareness, when they're not drawing the same connections. And so a lot of what motivates sort of the more advocacy and less of the personal environmental work is just how much progress you can make with somebody by drawing those connections with them and working with them to see how we can start to move forward and get more people on board so that we're doing this thing together.
For me, I think there's a generational difference here. When I was growing up, environment wasn't necessarily top of mind for a lot of people, society in general. But I recognized that there were things that were happening around me that were just not right. The Love Canal fiasco, if anybody knows that from learning from school. But I had the opportunity to go into Canada's North as an exchange student one summer. And as I was flying in over the beautiful, pristine areas, and we reached what was still called Frobisher Bay at the time, it was covered with waste. It was the whole harbor you could see. It was just so sad because everything else was just so clean. And it was at that point that I thought, no, this shouldn't happen. Our Western way of life is destroying what should be their option to live off the land, and it just didn't seem right to me. So even though I went into university thinking that this is the area that I'm going to be studying, it just became much more of a passion for me when I saw the devastation that our society brings to Earth.
Absolutely, Linda. Thank you so much. Lots of common themes. And Owen?
Yeah, I was trying to think of something kind of new to say in keeping with all the other ideas shared earlier, but perhaps I can share my journey started with a patient that I saw during my family medicine rotation first year, who came in with chronic obstructive lung disease and needing more puffers than normal because she said the air around her of lower quality. And for me as a student, of course, I can, work with a doctor to send her back with some more puffers, but I felt like that wasn't the solution. And at the same time in the hospital, I was seeing myself and my colleagues to put on unnecessarily amounts of waste in all the healthcare encounters that we have. And some of it important, some of it not as much. And reflecting on the juxtaposition between that patient coming in from air pollution associated COPD and the waste we just put out as a healthcare system made me kind of take action in this field.
I wonder if I might just jump in for a second. I hear a lot of individual experience in your motivations, like something concrete that happened to you that changed the course of how you're operating. What would you say to somebody who might not have had those experiences? How would you convince them that sustainability mattered, or show them?
I think stories are a really good way to convey our experiences to others. And a personal story is always a good way to go, as we've seen even today. I can show pictures. I can, these are all ways to convey the seriousness of it. But having it become personal to somebody, I think is the way to have them wake up if they haven't woken up to this as a issue at this point.
I feel like it's like deep down in human nature, what like inspires us most is connection. And like you said, stories are so powerful. Like at the end of the day, when you strip everything down and what really matters to people in life, it's the connections that they made in their family and friends. And when you're able to, even if someone can't necessarily empathize with something that has happened to you, we all have an inert sense of sympathy. So if you can make them related to something in their everyday life and someone they care about and something they are passionate about, you can tie almost any passion into the need to promote sustainability and protect the environment.
Yeah, that definitely resonates with me. I love those answers. I think, this is one of the central challenges that we have with climate change. I've been thinking about this so long, I totally forgot to bring out some stories for my motivation, but, I forgot who said this, but, one of the reasons that's often talked about for some of the cognitive dissonance that we have in addressing climate change and environmental issues is that there's a lack of a consistent and hopeful narrative that can be shared across all different interests, all different aspects of society, and that a lot of the things that people might be asked to do in terms of being able to address climate change amount to losses in their lives, and people feel that very strongly because those losses will happen now, whereas the losses that are due to climate change are also happening now, but they seem quite distant, and the ones that are merely years or decades away will be much greater losses, but they're felt much less if people aren't experiencing it themselves. And I think like an example of this that probably hit home really powerfully for me was I was speaking with a community member in Pikangikum last week. And that's a community in I guess northern Ontario, close to the border with Manitoba, and it is predominantly Indigenous population. And over the last 2 years, they've experienced 3 evacuations now, I believe, due to wildfires. And so each time, a lot of members of the community have had to leave their homes, leave everything behind, not sure if they'd be able to come back again, and also face not just a wildfire, but a great deal of racism from places that they've ended up. And so, clearly we don't want everyone to have to face something like that to make them think about climate change. But it is very challenging to find stories that connect with everyone.
Just on that note, what Ed was talking about in terms of facilities or municipalities or communities facing impacts of climate change, one of the things that we've been doing with the Canadian Coalition for Green Healthcare is doing surveys of hospitals across Canada with our Green Hospital Scorecard, and we're asking questions. Have you been impacted by extreme weather events, and how? And so we're now able to plot the increase in how much more extreme weather events organizations have been experiencing. And so instead of just taking it from the news from time to time, you have one event, you have another, but to see these events cumulatively through the years is really interesting. And they're not always the same. Like a facility can have a flood and then a fire. And so I think from a perspective of convincing somebody that this is going potentially to affect you soon, you may not have access to healthcare. That facility may have been challenged when you need it the most. And so that's another way of maybe convincing people that it will affect you or potentially affect you in the future as well.
I think I heard someone unmute themselves. Did someone else want to share? Okay, or we can go on to the next question. Thank you all so much for your thoughtful and informative answers. So for the next question, what can we do to demonstrate the importance of individual or organizational impact when societal action lags behind? So I'll just repeat just in case for our audience as well. So what can we do to demonstrate the importance of individual or organizational impact when societal action lags behind?
I think this is a good question for Sam to answer. How do you see that here as perhaps the youngest panelist here?
Perhaps the only one born in the 2000s, maybe, I don't know, but I don't know, like when I think of any major company that's ever come, it's like always started with one person, right? Like they always, it sounds cliche when they say like, oh, one person's not too small to make change, but it is kind of what happens. Like, for example, I could tell you about a company called 4Ocean. I don't know if anyone has ever heard of the company 4Ocean. You could react if you have, but like that literally started with two surfers who went to Indonesia to surf and then noticed, just like Linda was talking about, how much plastic pollution had washed up on the beaches and how the fishermen had like no success catching fish and it destroyed their economy. And they've made this insanely massive company now that they pay fishermen to go fish plastic out of the sea, hire local women to create bracelets out of the recycled plastic, and then they sell them. And they are so popular amongst my age group. Like I see dozens of them a day, and this just started from one little idea. And I can say, like, even with my involvement on like the Ontario Nature Youth Council, when it started, it was like 5 or 6 youth, but within a decade now, there's hundreds of youth on the youth council, because it just takes one, and there's chances are if there's something that matters to you and lights a fire in you, there's a lot of people on this world. You're gonna find someone else who has that same passion, and from there it just kind of grows. It's the same thing with like computers and cell phones. They didn't exist, and then someone started it, and now literally everyone has one. So obviously it's not like easier said than done, but just I think you impact so many people on a daily basis that you wouldn't even realize. So leading on what you believe in has massive chain effects. It's just like, think of how fast a rumor can spread. It's just like how fast you can ignite change by just being a leader and fighting for something you believe in.
That was really well said, Sam. I want to just echo what Sam was saying about the power of individual passion, how it spreads kind of like almost like a contagious effect through like Project Green Healthcare. I remember like 2 years ago, I was talking with my colleague Jacob about sustainability in healthcare and how there's a gap in medical education. We're like, maybe we can address that. And at that time, it was a big maybe. But over that Zoom call, we got excited. And we started to think about how we can get it started. So we put an application for a grant, and we got awarded that grant, which started off this huge chain reaction, where now we have over 100 medical students and health sector stakeholders collaborating on greening healthcare projects across Canada. And realistically, although a lot of time and thought has gone into it, it started off with that conversation and just feeling comfortable to, in that discomfort, knowing that, maybe we can do it, maybe we can't, but it doesn't hurt to try.
Thank you
Those are
both so much for sharing. Perhaps
those are
Tatiana,
great
would you like to share?
Or Linda, did you have a comment?
No, I just want to say those are great stories. I love them. I love the passion that is coming out of that, because that's really what can drive it. So I'll let you speak.
I don't know if I'm a good person to address this question. I have a fundamental sort of a problem with this question, because I think the second we have some individual starting to act, or an organization starting to act, to me, that is societal action, and we are all part of this. And I think the trick is to try and convince whatever culture silo you're in that it's relevant to that culture silo. And I think that can be really difficult, especially given all of the restrictions that we have, and all of the barriers we might have. So it's not only convincing people that this is actually happening, but it's convincing them that it's worth their time, that it's important to prioritize above other things that seem really important to them in the moment. And so sort of, this is partly answering motivation, but also partly demonstrating importance, is situating environmentalism within their priority set and rationalizing it based on how they rationalize all their other priorities. So in healthcare, it's kind of crass to say, but part of what motivates and what shows that environmentalism is realistic is situating it in its financial sort of gains, or its possibility and its ease of use, and getting people in the door that way, I think is really important. So I apologize for not addressing that question quite directly, but yeah.
Yeah,
Sorry,
go ahead.
I was just going to say that I also think that it's worth, interrogating the question and asking ourselves, in what domain are we talking about societal action lagging behind? And as Tatiana alluded to, like what parts of society are we talking about? It's a different circumstance when we're talking about lagging medical education around climate change and sustainability versus, building dense neighborhoods rather than sprawling sort of real estate favored patterns of development. Those are very different things, and the lag is going to be different for obviously different reasons. And so I think like the role of individual and organizational impact and how we would demonstrate that, or what strategies we might propose to address these areas of lag, I think differ tremendously. I would say that, again, a day before the Day of Reconciliation, it's important to highlight the fact that there are certainly large segments of society that, are behind the actions taking place across what's Canada against resource extraction. And that's definitely not an area that we should ignore.
Yeah, I'm really happy to be following Tatiana and Colin, because I had let it, I had let Ariana know that I would also like to interrogate this question. I think it's really important to appreciate the role of individual efforts in order to inspire people and be the nidus of advocacy and organization. And I think it's also, we've seen extremely important to make these issues more visible. And, where I work, for example, there's also a green team, and they host lots of events. They have Facebook groups, they have posters around the hospital. I think also we need to be careful that mainstreaming doesn't itself lead to inaction and undermine the ultimate goal. Not, that we focus so much on the intermediate goals that we lose the sense of urgency of what we are trying to achieve. And I think there's a lot of risk that that individual and organizational impact can be co-opted by industry, for example, like the legacy of what's still ongoing in terms of what large oil companies have done in terms of their messaging around tracking, individual carbon impact, for example, and downplaying climate science. And still we're seeing that there are delaying tactics, and one of those would be to focus on individual impact. And so I think it's important to highlight individual impact or organizational impact only in that it's instrumental to fulfilling the ultimate goal. And if we're talking about climate change, for example, by hitting that 1.5 degree Celsius target or better than that. And I forgot who said this recently, but they made a really good point that, these net zero targets that we're seeing pop up on the media, that certain companies are trying to meet net zero or their goals for institutions. Net zero is not meant to be downscaled to an individual or an institution. The purpose of it is whole of society and whole of the world in order to achieve the goals that we collectively need to. And so I think there's definitely a strong role for individual and organizational impact, obviously, but only if the final goals are kept in perspective.
These are all really wonderful points. Thank you all so much. And yeah, it shows that we have a group of smart, thoughtful people here, not just taking a question at face value. You're actually thinking about the quality of the question and the perspective of it. So I think that's great. And some of the best solutions come from asking, better questions, right? And there's an art to questioning for sure. So yes, thank you so much. So we're going to go on to the next question. So what are the impacts of role modeling for others, and how have you done this?
There's also just a comment from the audience that we've talked a lot about sort of overall goals and differences in approaching goals, but if we could weave in some concrete solutions that people can take in terms of making healthcare more sustainable, or making our individual versus collective action, or improving that sustainability, the audience would appreciate that too, just in your answers.
Concrete examples of role modeling.
I think if I can kick this off, role modeling is, again, speaking about that more individualistic scope. You start to see someone you respect doing something, and you start to question your own worldview. Why am I not doing this thing? What am I missing? And in that way, we can start to get people, again, sort of questioning the way that they're doing things. And I think that this is a huge bit of this, and it's something that I've found in myself and those that hop on. It doesn't matter how people get started, but once you do get started, you start thinking about your world and the way that it's everything around you is interacting with other things as an environmentalism or as an environmentalistic process. And so the way that we role model within our organization is a lot to do with sort of a positive thing, because per some last points, we have a lot of industry giving us personal responsibility, and that fear can really cripple people and make them feel less included and less likely to enact change personally and organizationally and on an advocacy front. And so what we do is we try to make it really fun. We try to change the narrative of environmentalism a lot. And so we do like a bi-weekly newsletter, simple challenges, but then sharing, hey, this specific person that you know and respect and want to be like, has done this, and look at, how happy they are and how much team development has occurred as a result, because that's huge during COVID. How can we make people feel like part of a team again, and not so much isolated? And yeah, so I think the impacts of role modeling are really far reaching. And I think it's a really important process for sure.
Thank you so much for sharing. Yes, and I heard a little bit about, how you are changing the culture essentially at the place that you're working at. And that's definitely something worth looking into and researching, right? Like, how can we actually be strategic in establishing a culture around greening our community, or whichever community we're in, workplace, volunteering, etc.
So important for building momentum, but then maintaining that momentum going forward, ensuring that it's on the table in the future.
I just wanted to share maybe a little bit about a project we're working on where we're to work with PPE in hospital generated PPE waste, particularly from COVID. We see a lot more of this, and we have a project with Environment and Climate Change Canada to see what we can do about PPE. It started off as a recycling project, and we stepped back and we looked at it and say, recycling is not the answer. We have to go up the hierarchy. We have to go look at reduction and reuse as much as possible. Anything that we can't manage or that becomes waste, then we look at recycling. And up to this point, I think in most situations, it's industry who has been kind of calling the shots. They've been giving healthcare products, which we have to then manage, and we really have no say in it. And I think a collective effort to identify that, no, we don't want to manage these products this way. We, as a healthcare system, can become much more sustainable if we focus on reduction and reuse, and we need our products changed as a result of that. So it's a small project. It is a national project, but it is an effort that I think will take hold because of the COVID situation that we were in and the supply chain problems that we had. We had problems in getting PPE. Having reusable, locally generated gowns is a much more sustainable answer, creates local jobs, and it's much more climate intensive. So it's what I wanted to say with this is that we've relied on, we haven't even thought about this as a healthcare sector on how industry is actually dictating how we operate. And we have an opportunity, I think, now to say, hold on, we don't want to do that anymore because it makes much more sense for us to operate this way. And so making small changes like reusable gowns, making sure that we can use those instead of disposable ones is a first little step, but it paves the way for other single-use products, for example, to find reusable substitutes.
Linda, if you wouldn't mind, I'd like to just ask just for a little bit more detail. So besides gowns, what other items did you manage to make reusable, and how did you get the buy-in for that?
So we didn't make these reusable, but what we identified is we uncovered two organizations, two healthcare organizations that spurred the development of reusable N95s. And so in Manitoba, one that we were just interviewing, they created a reusable N95. The filter is replaceable. So you have I think it's a silicone facial part, and then the filter is taken out, it's cleaned, and then it's reused. And that came out of an innovation from doctors working in Manitoba who saw this as an opportunity. And it was approved by Health Canada. So, they went through the whole process, but very quickly because healthcare moves so slowly generally, but this was a great opportunity. There are opportunities as well for reusable surgical masks. CHEO, the hospital in Ottawa, had developed one that they thought was appropriate for non-patient contact areas. But Health Canada doesn't approve everything very quickly, so that has not been approved. But what I wanted to share with you on this is that these difficult situations we've been going through with COVID have really spurred innovations. And if we cannot revert back to our original normal and move forward instead, take that as a learning opportunity, I think we'll be, addressing climate change at the same time. So it may be an opportune time to do everything at once, COVID and climate change.
Lovely, thank you. Yeah, there's a quote, right, that says within every challenge there's opportunity, right? We just got to keep reminding ourselves of that and remind each other of that too. Sure. Would anyone else like to share about role modeling?
I just have a question for everyone. I'm wondering, so we talk a lot about individual action, and I wonder what you would tell people or what you would demonstrate to people through role modeling who say, you know, I'm recycling in my house, I'm doing everything I can, but nobody's joining me and I can't find, you know, people to move this forward. What would you share with those people or demonstrate through your work?
I think it's all about finding community. For those people who are recycling and not finding that sort of support in their household, I would probably recommend a really practical answer. Like there are a lot of buy nothing groups online, and they can be incredibly motivating just because of the awareness of the number of people right next door to you, especially during COVID. We feel isolated from our neighbors and our communities, and that can be incredibly demotivating. So I mean, this person's having trouble finding a community, but if they are able to find a community, I think that's, yeah, it's just so incredibly motivating, because the second you're like frustrated as heck that your grocery store isn't moving to paper bags for your mushrooms or something like that, you can talk to people about it, and somebody knows somebody who can help you make change. And yeah, I think what I've learned here is it's all about teamwork and feeding off of each other, because it is a big problem, and it affects every single aspect of our lives and every action that we have.
I'd like to share a couple of examples. So one organization I work with is Toronto Environmental Alliance, and they're a local environmental NGO based out of Toronto, obviously. And they've tried to do something that's similar to actually what Tatiana just mentioned, which is they have had a project for the last 2 or 3 years called Community Hubs, where they use community health centers or recreational centers or other central locations in a neighborhood to bring people together around issues of what is happening with the environment in their neighborhood, and showing people the importance of being able to take neighborhood action. And so it's taken the form of basically whatever the community needs and thinks is important. So some have done lessons to teach adults and kids how to ride a bike. There have been community garden projects. But basically it's, you know, the neighborhood deciding what's important for the neighborhood, and at the same time, thanks for sharing that, Sophia, also demonstrating that that local action can have an impact. And the second part of that I thought was really cool is Toronto Environmental Alliance has also been very thoughtful about who is in the role to be modeled. And you know, one of the traditional things that's happened in environmental movements is that it in the past has catered to certain demographics. And so Toronto Environmental Alliance is also trying to make sure that its staff and its leadership and the people who are in those community positions represent the communities, and make sure that the needs are listened to, and that the actions respond to that. They've also got this great project that also recently wrapped up. It's zero waste high rises, where there's large apartment buildings, and actually the supervisors and the people running the buildings were very enthusiastic about this, but because they're private organizations, they have to pay to have their waste taken away. And they found that they could develop instead a circular economy within a high rise, where people would be throwing out things all the time that were perfectly good and didn't know that others wanted it. And so instead they had an area close to their waste disposal area, where you could take things that you no longer need but were still working. And actually some buildings even just walked up to the garbage chute and said, look, you actually have to take it down, so you walk past the circular economy sharing shelf or whatever it was, so that you're reminded that that's something that you can do instead of throwing things out. And then, you know, in terms of other role modeling, Canadian Association of Physicians for the Environment and other groups have created communities of practice as well, to let people share ideas across wide geographic expanses, which has been, yeah, really cool.
Awesome. Thanks so much, Edward. Thank you for the concrete, informative examples. Would anyone else like to share?
Yeah, in terms of role modeling, something that's kind of interesting, or something that I think we still struggle with in sustainability efforts, is that often, especially individually, there's a lot of moral injury when it comes to being an environmentalist. I find this for myself quite a bit, because we can always, for example, eat, travel, live, work more sustainable. But there are so many barriers, as we alluded to earlier in this discussion, that are built into our society that make it very difficult to make those choices to reduce our, for example, personal carbon footprint. And I think this is particularly true for myself as a medical student's trainee. Perhaps Sam would resonate with this, because a lot of the decisions that are made in the healthcare system that I'm part of, I can influence, I can try my best to influence, but often there's someone in charge that ultimately makes the call. So what I've been trying to do in terms of role modeling to kind of address a little bit of the moral injury that we face as individuals and trainees is to, during any single time I'm invited to present about healthcare sustainability to my colleagues across Canada, I try my best to provide some like tangible tips that medical students can take to their rotations to advocate to the preceptors for certain more sustainable choices. And for concrete examples, like instead of picking a meter dose inhaler, they can pick a dry powdered one, or advocate for that for patients with obstructive lung diseases. Or during the anesthesia rotation, they can tell their anesthesiologist to maybe use sevoflurane instead of desflurane for induction and maintenance. So all these things, I try to kind of put the ball back in the trainee's court to reduce the moral injury. Hopefully that answers your question.
Yeah, that's great. And yeah, I think I also like doing the same thing. I mean, being a teacher, I know I'm not one of the panelists, but yeah, I just wanted to include too, like, it's nice to consider your audience, right? And that they do want those concrete examples. Not everyone has so much time to think about what to do and research. So if we can just distill it down and give them, you know, those main things that make the biggest impact, you know, in their community, then that's really helpful for sure. All right. So we'll move on to the next one. So what strategies can you share with others working towards similar goals in a different field or industry? What have you learned from your own changes? So is there anything, any kind of guiding principles or rules of thumb that you think would be transferable from whichever industry you're working in to another one?
I would say that one thing I've learned, as I've faced a lot of rejection when I just like try to get different small environmental changes in the places that I have been exposed to, which are, you know, more like teenage jobs. Like I remember at a gym that I worked at, they would serve like smoothies and people would buy their like $8 smoothie after their workout. It was a very prestigious gym. And I would watch from teaching lessons in the swimming pool, and it seemed like everyone would just get their drink and then sit down and drink it right there. And so then when I went and talked to the cashier, I surveyed 3 different ones over the course of a couple of weeks. And I asked like, what percentage of customers actually take their drink to go versus just stay and drink it here? And it was actually probably a good 90% ratio to just take it, drink it right there, and then leave the gym. So when that's just one example of something that I noticed that was so unnecessary, because like, why do people need all this plastic when you're using it right there? And like, it has the money and facilities to implement a reusable system. And so when I did reach out to like the managers, they're like, oh yeah, like we're totally capable of doing that, but it has to be approved by like the head of like head of, because it was like a franchise gym. Or when I talked to restaurants about their policies on just letting people take things in their own containers, like if I'm going to Tim Hortons and getting a cookie, do I really need it in a bag that I'm going to immediately remove it from? Or if you go to Subway, do you really need to put your sub into a plastic bag when you're going to take it right back out? And they're just like, oh, it's corporation mandate. So something I've learned is it always often stems from like the very head of like the head of corporations, and it's not necessarily because people don't want to make change. It's just because we have such a long process of making change happen, like the legal system, that it can take a long time to actually get to the bottom and make change. So that's probably one of the largest like frustrations I've noticed. Like even working at a vaccine clinic, it's like a slap in the face when I have to give out about 3,000 to 4,000 masks a day to people, and they're just like, oh, I literally just opened this one up, and I'm like, you still got to wear ours, and then they just take theirs off and throw it out. Like just the amount of unnecessary waste, or the nurses that for every shot they have to change their gloves and they're going through hundreds and hundreds of pairs a day. But when you talk, it's often like, oh, it's just because there's a rule up at the corporate top. So what I find the best thing to do is try to weasel your way up to the top. LinkedIn is very useful for finding like the heads of organizations, and then often I'll message them and then talk to them there, and then they have the power to just say something and change everything, but it's hard to reach them is what I find.
Thank you. Would anyone, or does anyone have any experience with you know, getting buy-in from your higher ups? Any kind of examples that maybe Sam and other audience members can learn from?
Just wondered if I could pipe in here. I wonder if somebody who knows about shoreline cleanup, the top 25 environmentalists, Sophia, I just thought that I know you don't want to be put on the spot, but just wonder if you could answer the question yourself about what you've done and motivating other people environmentally. I think it'd be interesting for others.
All right, thank you. I'm a moderator slash panelist now. Thank you, Neil. So yes, that's how my journey began, and I would actually like to see if anyone did have like a positive experience in terms of not climbing up the ladder, but basically again like weaseling your way up, just like Sam said, like that wording. But yeah, so that's how I started my journey. Like I just started doing cleanups because I had a hard time finding volunteer opportunities. So I came across this or like if there were volunteering gigs, like I needed to like fill out an application, and I would be contacted by this organization. I was like, I just want to do things now. So yeah, I was just the cleanup girl for a while. And yeah, I actually got quite a few friends like really into environmentalism just through my enthusiasm and getting them like I want to use Sam's wording of weaseling, because it's like you kind of bait them with like, look, it's going to be fun, like we're going to be moving, we can do some movement in the beginning, I'll bring my speaker, make it kind of like a fun thing, like a party. Maybe you can't do that in the office, but yeah. And Tatiana, I think, mentioned too, like how can we make it fun? And then once they're there, it's like they usually want to do extra things, or like there's questions that they ask. So I think, yeah, like I think cleanups are actually a really wonderful way of getting people involved initially, like regardless what sector we work in, right? People get to see that like that garbage that's outside, that's just there until it gets cleaned up, and then it starts to spark this curiosity. So yeah, shorelinecleanup.ca, it's pretty easy to become a volunteer and a participant. Yeah. Thanks, Neil. And yeah, that's a very concrete thing, right? Clean up, and then you have awesome pictures before, after. Yeah.
I can share a story. When we were building our house, my husband is an engineer, and so we designed our own house. And this was before ground source heat pumps were actually a very popular or government grant condoned thing. And to put our plan forward to the municipality, they didn't know what to do with us because we didn't have a typical furnace. And they required everybody to have a furnace, but we didn't. And so it was an educational process. We took them through that. And gradually it became the norm for the municipality to understand that there are other alternative approaches to heating homes. And so that was a little learning experience for us and for them, I think. But I also wanted to share something else. And in Ontario, there's a few of us that have come together, a few docs and myself, and we're forming an Ontario-based green healthcare organization. There's a national one, which I'm also employed with, and there's Toronto regional ones, and there's other areas across Canada that have their own, but Ontario doesn't. So we have been developing an Ontario-based green healthcare organization. And one of the things that we've been doing is reaching out to different people where they have a little bit of knowledge about something, and asking them to provide a little 10-second testimonial or something like that. And so by sharing information just on what you've been doing, and you don't even realize that it's a great thing, but for somebody else it could be. So just getting the information out there and sharing it amongst your peers, docs speaking to docs or directors speaking to directors, that's the kind of thing that we're trying to do. And as a fun thing, one of the things that we thought we would do is to have offer this as a challenge. Maybe one day or 1 week or 1 month, maybe we send out a challenge that we want to create all the lists of opportunities for carbon reduction maybe in the obstetrics department or something like that. And so anybody who wants to join the challenge then can do that. And then we pool all the information, and then we create something that's useful for everybody. So challenges can be fun as well. And it motivates people to take action at the same time, which can be good.
It sounds like a lot of the projects that you've all started have really started with a fundamental question, like how can we do better? And I'm wondering, is there a series of questions that individuals who are not connected yet with groups or maybe just individuals at the bottom, what are some questions that they should be thinking about asking the higher ups for change to actually happen?
Sorry, I don't have any questions, but to respond to the original question and to add on to what Linda had said, and also, what someone else had said earlier, I'm sorry, I can't remember, but I think for healthcare where there's a lot of work amongst institutions, I found that reading the strategic plan has been pretty important, because often with talking to these higher ups that you've weaseled your way into, there needs to be some discussion around alignment of goals. And so trying to play to the interests of the person you're talking to, and making sure that the proposals and the ideas that you're presenting are heard by open ears, essentially. And so I think we talked about this before, but demonstrating impact is important in that way for scaling changes. And then the other thing that I thought has been important, and I've seen great examples of people who've been able to do this well, is differentiating between strategy and tactics in implementing something, or the difference between long-term strategy and short-term actions. Making sure that those short-term actions built up support each other and lead towards the long-term strategy, rather than just being one-offs, so that there is building on each other. So I think quick wins are really important, but making sure that there is some change in the underlying structures will be more sustainable, let's say. So for example, if we talk about switching inhalers, that's not the last step in the process. Obviously, I think it's really great if, in our clinics, we're able to change our patients over to more sustainable inhalers. but it's also a springboard to more systemic change. So I'm also working on a project now to consider medication device regulation and the review system for those, and how to potentially incorporate sustainability as a key criterion without, and so that is working upstream of the problem. And so I think, I think it's maybe using the public health paradigm of going upstream to figure out why people keep falling in the river and getting washed down. We already had SARS a long time ago. We should have been prepared for COVID, but we haven't. And it's because the underlying structures didn't change after SARS.
You brought in, oh, sorry.
I told Sophia that I wasn't going to say anything for this question, but Edward said something that sort of tweaked my imagination. And I think that in terms of strategies or orientations that I think are important for anybody doing any sort of work relating to environment sustainability, is to look as far upstream as you possibly can, and see where you can act. If you can act effectively more upstream than your sort of current conception. So, for example, around healthcare specifically, that would mean, what determines health and healthcare utilization is, partly population health, and population health is in great part not really determined by the health system itself. It's the social determinants of health. And so obviously everybody knows this, but I think that, making that connection to like, what is sustainable healthcare, because people think about what is, obvious right in front of them. They see the masks in the gutters, they see the gloves, and then all that stuff is obviously bad and wasteful. But I think that sometimes the things that you can't see are orders of magnitude more impactful if you can change them, and harmful if they continue. I guess listening to Sam's story about the smoothie company, it had me thinking about what does their supply chain look like? Where are they growing their, who provides their crops? So what is the process by which they get the berries that they get, and how do they pay their servers? Like, all of this stuff is it kind of seems tangential to sustainability, but I think that we're talking about such a massive paradigm shift in terms of, how the majority of us live in Canada, that all of these things are on the table. And that also links into how do you make this relevant to people, because most people, polls show, are very concerned about climate change. It's not that people aren't worried. Like, there's so many memes about climate anxiety that I think it's hard to say that, people don't care. It's just a matter of connecting it where people are at. And so having this broad view of sustainability that's really social, that's really everywhere, helps connect things for people, and I think helps with some of that hopelessness, because the people who are fighting for racial justice, to defund the police, these things are all related to sustainability, I think, and sort of broader social transformation that's necessary to achieve a 1.5 C degree world and better.
I think it's really interesting to, so strategic planning has been brought up, and the fact that we can embed environmentalism in with we can kind of hitch our wagon to other movements in society, because we need that momentum as well. So part of what we had done early on in our project was to embed environmental sustainability of healthcare within both our strategic planning and within quality improvement. And the way that we kind of achieved that was by saying everything else in your strategic plan has to do with environmentalism, the equity that you want to have, the disease prevention that you want to have. All of this has to do with providing more environmentally friendly care. And by considering that, and so it not only gets people to start to think about it, how it's going to fit into those structures, because I think, to your point, it's such a massive paradigm shift that people are just exhausted. They're like, oh, there's so much to change, but we can work within existing structures, because it might help to just get people going, but also all of these things have such synergy together. And so if we can kind of put them in the same boat together, we can kind of help put environmentalism in the top.
Great points, everyone. Thank you so much. And yeah, I mean, I'm kind of the word like systems thinking, or the skill of systems thinking comes to mind, which is something that me as an educator, like we're encouraged to, encourage systems thinking in the classroom, just understanding how systems work and how we can identify systems. And so I think that's also an important thing to consider for sure, understanding how the system works that you are a part of, which you were alluding to or talking about. And I just did or completed an online diploma on corporate sustainability reporting. And that's one of the key things that they were saying, is that you need to understand, and this is across industries, you need to understand where exactly is the impact, like rather than having all this impact along the way logistically, and then, hey, we're doing a cleanup, share that on social media. All right, great, we've done our part. Looking to see how you can reduce your impact instead of, putting like a pretty picture on top. That's another thing I'd like to add. All right.
I just
So
had
let's-
another thought there.
Yeah.
And we've talked a lot about the workforce, but I think corporation boards of directors also have a big role to play. And you kind of made me think about that with corporate sustainability reporting. And for climate change resiliency, or for climate change and risk, the board should be asking questions of the organization. How are you prepared for climate change? What kind of risk assessment have you done? What is your plan? And this has not happened so far in the healthcare sector. The boards have not been engaged in that way, as far as I know. I think it's just starting to happen in BC, where the Minister of Health and the board chairs of the healthcare corporations have got it in their letters that they need to address this. So not just the sustainability plan, but a plan to respond to questions that the boards of directors may start asking. And from what I've seen, it is becoming one of their roles as a board of director. You need to start considering climate risks. And so the more we can educate the boards of directors as well on this, they are the ones that will say, okay, now you have to provide as a corporation to us, these kinds of plans or these kinds of assessments. So the boards of directors, I think, are a good place to go to start stimulating the actions. If the organization is reticent to do it on their own, if the board asks, then they will have to do it.
Thank you so much, Linda, for adding that perspective in there as well. Unless anyone else wants to comment, we're going to move on to another question. Which is, what are some financial considerations for shifting to a greener workplace? And how can we overcome any barriers?
I think Ed pointed this out earlier, is going for the low-hanging fruit, first of all. And a lot of the times it's energy savings that you can have, and that has a fairly clean payback period. Using that as your kind of bundle of cash that then you can play with to apply to other things. Some organizations have developed green revolving funds internally, so that they make these investments, they get a payback, and they put it away from the general coffers of the organization. So it's targeting sustainability actions. So green revolving funds have been used by universities, by healthcare corporations, by large businesses as a mechanism to self-finance some of these things.
I just want to jump in there really quickly too, because I did some fundraisers with my school. It was actually like a textile donations fundraiser, like everyone donated textiles or clothes, and then we used those funds to fund other eco projects. Awesome idea. Thank you, Linda.
Something I was going to say that I find interesting is everyone likes money, and corporations obviously don't want to be losing money, which is one of the huge barriers of doing more environmental things. Like, why would like I spend 3 times the price per this versus when we can get it at that, and budgeting and stuff. But when you actually like look into like the cost of like, for example, just our green spaces in Ontario provide over $20 billion of ecosystem services each year for us, from water filtration to soil erosion prevention. So when you can show a number, a monetary value, that also often encourages people. Like in New York, when they replaced all of their stoplights from like incandescent bulbs to, I think they replaced to LED, like their electricity savings is like, I think I know this is a large difference in number. It was either 6 million or $6 billion like a year, which isn't like something to blink your eyes at. So people often get hindered by the upfront cost, but when we can advertise the long-term benefits in the selfish lens of money, because people don't always care about, it's like, oh, if you do this, you'll protect this species or this certain bug. And people are like, well, I don't like bugs anyways, so why would I really care about that? But like, sometimes I've found if you have to almost shift it to make people selfishly want it, like, oh, look how much money I'm going to save by doing that, then they're going to be more likely to do it.
Yeah, I really like that answer, Sam, and totally agree with Linda as well. One of the places I work is University Health Network, which is a hospital network in Toronto. And one of their really cool energy stewardship projects was a deep water cooling system that basically it's a heat exchange system that doesn't rely on or saves a lot more electricity to cool the building. And I'm sure Ed Rubenstein knows a number off the top of his head, but it basically saves millions of dollars, and also saves tons of emissions in terms of the avoided energy that would otherwise go into cooling. And so I think the financial considerations sometimes are more psychological considerations, or a lack of awareness of innovations that currently exist. And the other way I like to think about this, I want to share, I'm sharing someone's tweet, Andrea McNeil's tweet, because I think the Lancet Planetary Health didn't let her put this amazing figure in the actual article, but I really like the way that she's conceptualized this issue in terms of, how to reduce health service emissions. And it's not just about spending more money to make the workplace greener. It's also about reducing demand for services, making sure that there's better matching of health services to demand, so improving the appropriateness of care. And then when that's not possible, reducing the emissions intensity of services. But I think what's key for me here is that there's a reduction in waste that can be reduced. And so, for example, choosing wisely is one of the best examples that I can think of right now as a very well organized process of how to reduce waste, and that should actually save the health system money rather than costing more. And then in terms of other workplace things, like getting rid of exam paper table has been one of the things that's been taken up around the clinics that I know of, where when you stop to think about it, having paper on an exam table doesn't make any sense, because you still have to clean the table afterwards. It's not like the paper wraps the entire table and then you end up with a useless piece of paper afterwards. So I think that's probably the way that I'd frame it, in terms of where can I find the savings, where can I actually improve, if we're talking about health, where can I actually improve care while also reducing emissions and improving sustainability. Co-benefits, I guess.
Thank you, Edward. Great points. Yeah, Linda?
Yeah, I just wanted to add on top of, as Choosing Wisely Canada is such a great example of reduction, right? I mean, and also on top of that is public health and making our communities healthier to begin with, and looking at what environmental impacts people are having on their health takes us to various industrial areas. But the other example I just wanted to give on the PPE stuff was in the UK. They have an annual glove reduction week, and they save lots of money. There was a case study that was provided by one of the hospitals that did this by using the gloves properly. And, somebody was mentioning earlier about, you have to have a new pair of gloves every time you do something else. Well, looking at it, stepping back and looking at what's actually required from an infection prevention and control perspective, maybe we can really use our gloves a little bit better and reduce the amount of glove use without impacting infection prevention and control. So I think being able to step back and take that view with the people who have that kind of expertise can lend another pair of eyes to how we can actually accomplish reduction, because reduction is the ultimate saving, really. Yeah.
Can I add
Absolutely.
one more? Sorry.
Yes, please do.
I just had one more thought, and it's of shifting the idea of what workplaces are. And I think something that Colin said before reminded me of this, that when we think of workplace, we're accepting what the status quo is right now of workplaces. And I think greening workplaces also involves potentially valuing jobs and valuing work that are not extractive and instead contribute to a caring economy or contribute to a circular economy. And that includes valuing a lot of work that currently goes unpaid. And I think, what that would involve is a societal shift towards not greening existing workplaces, but enhancing and recognizing the value of work and workplaces that are currently existing, where people are maybe not getting paid, and basically turning those into workplaces will also shift towards greening as well.
Would you mind giving an example, like to what kind of work you're talking about?
Yeah, that's a great question. So for example, a lot of people would consider caring jobs to be greener jobs in that, they are less resource intensive. So healthcare is considered to be one, but what reminded me of this is also actually something that Linda said, where preventive services are extremely important, do contribute to sustainability, but are extremely undervalued. Before, like I'm talking about Ontario, but 2 years ago, before the pandemic, the Ontario government was planning to cut public health spending by significant amounts. And we would have actually had to consolidate and reduce the number of public health units in Ontario had that gone ahead. But instead COVID happened. And so I think, shifting more towards, within healthcare, I would say shifting more towards preventive services, population health services, and the caring economy would shift more workplaces towards, or I guess make a greater proportion of workplaces green by that nature.
So if I could jump in, one example, anti-anxiety drugs, and for the elderly especially, maybe they just need somebody to be with them for a while. Maybe they need to go for a walk in the park. Maybe they need a massage. These are all things that could be paid work instead of spending our funds on pharmaceuticals. And that could, again, achieve those climate reductions as well at the same time. How do we do that, Ed? We need to set up a case study somewhere.
There's a lot of really good data on social prescribing in the UK that you might be able to just sort of use and help convince that and drive that agenda. I just wanted to add to that point. I think we do reproduce a lot of services as a result of not having people who, like social navigators, who can point people in the right direction. And that just in and of itself, that reproduction of services means that we're wasting, right? As when we're talking about avoiding, reducing, reusing, recycling, right? Let's not reinvent the wheel on what's already existing. So I really enjoyed that point about ensuring that we're recognizing work and to that end, ensuring that we have really good ways of using the things that we have.
Amazing points. Thank you so much, everyone. So we have about 10 minutes before the Q&A. So I just wanted to kind of wrap it up with a final question, ideally hear from everyone. So would you have any suggestions as to where we can start in moving this conversation and actions following this roundtable? And also just wanted to add, like, is there a way that people can get in touch with you, or is there like a resource that you think has been very instrumental that you can refer people to? So actions following this roundtable, and how can people be in touch with you, or is there a resource you'd like to share?
If we look at a decarbonization pathway for healthcare for Canada, just a little project here, but there are some ideas on how to decarbonize our healthcare sector. And if we look at some of the main areas that are perhaps better addressed by a medical community or medical workforce rather than, let's say, facility directors or whatever, maybe that's something to consider for this group. Not that I don't know if you're all medical, are you, or most, is it? I don't know. but if excuse me, if healthcare is one of those areas that you would like to focus on, then I maybe go to one of those decarbonization pathways. And pharmaceuticals and chemicals were one of them. Anesthetic gases were mentioned earlier as well. But drugs, our prescribing of drugs is a big one. I can provide a couple of links to the organization I work with, and the Ontario one that's just coming out. I can provide that as well.
Thank you so much, Linda. Maybe we'll go with Owen next.
Sure. I think the biggest takeaway in terms of kind of promoting sustainable behaviors sustainably over the long term, I think is what was mentioned earlier on this talk from my colleagues about finding community. And I think this has been critical for me as a trainee. I was kind of like jumped into this field and found CFMS Heart, a group of medical students interested in something similar to what I am. And then I founded a community of practice, as was alluded to earlier, to encourage more medical students to think about sustainable healthcare. And we've talked about how like the Canadian Coalition of Green Healthcare is another form of community of practice for organizations to kind of benchmark each other and share best practices. And CAPE is another way for physicians and healthcare practitioners to get involved and share ideas and make sure that change is implemented both locally and systemically. So I think that's critical for us all in order to find those spaces where people share our ideals and where we can build individual action into societal change.
Wonderful, thank you. Maybe Tatiana?
I think a lot of what I would love to see, and this is on a few people's notes, just we don't have a lot of data from Canada, from all of the different contexts that we could around environmentalism. And so it's something that I want to personally forward within my organization is reports on our sort of emissions and our own impact, so that we can individually change. But I think that sharing those sorts of results are going to be really instrumental, especially within healthcare, because nobody listens to you unless you have numbers and clear goals and clear outcomes. And so I don't know if that's within anyone's wheelhouse to start doing in their areas, but it's something that I think could be incredibly useful to help show how important this is, because it's something that healthcare looks to change their culture all the time.
My sort of closing thoughts would be that, again, especially with the Day for Reconciliation coming up, and recognizing that, Indigenous resistance. There's a report recently from Indigenous Environmental Network that documented how Indigenous resistance across Canada and the US has been responsible for mitigation of about 25% of both countries' national emissions footprint over the last 10 years. So obviously that's a huge sustainability impact, but we also know that our health systems are sort of foundationally anti-Indigenous, and one of the remedies, at least a start for that, is the Truth and Reconciliation Commission's calls to action. And so I think that if we're taking a big picture view of how the health system fits into this sustainability transition, we need to think about our obligations as people living on this land, those of us who are not Indigenous, to be in sort of the right relations with the First Nations, Inuit, and Métis people who have lived here and continue to live here. So I would say definitely go read the Truth and Reconciliation calls to action, figure out which are relevant to you and your workplace, and also check out the Yellowhead Institute's Truth and Reconciliation Commission calls to action progress report from 2020. It's pretty illuminating. So that would be my suggestion, and I'm happy to have my email shared by the hosts.
Thank you, Colin. Appreciate you sharing, a specific document that we can go to. If anyone has any, videos, documentaries, documents, publications you'd like to share, feel free. Edward, would you like to go next?
Yeah, thanks. I think my closing thought for a resource, which I mentioned to Arian before, is voting and citizen engagement. So, we just finished so it's free, and we just finished our federal election, but municipal and provincial elections are important as well, and obviously coming up. And then the two organizations that I mentioned before, Toronto Environmental Alliance and Center for Sustainable Health Systems, I'll pop those links in the chat. And then following on from what Colin said, Indigenous Climate Action is a great organization. In Canada, they also released a number of reports over the past year, including one that looks at federal climate change legislation from an Indigenous lens, and finds that there's definitely some gaps and areas that could absolutely be improved. And I think that report is very important after you've read the TRC recommendations.
Wonderful. Thank you, Edward. And Sam?
So I guess just, closing remarks. In my opinion, what I've learned so far in my 19 rotations around the sun is that knowledge is truly power. So the more that you can educate yourself, the more you can educate other people, and the more that change will start to happen. And when you are looking at something, like if I were to say like, oh, you need to now become like a competitive yodeler, maybe you're not interested in yodeling, so it's not going to be very passionate to have to spend all your time doing that. So when you are learning, find something that does like ignite that flame within you, something that you really care about, because when you care about something, it then doesn't feel like work, it just feels like living. And the way you can inspire others around. And that's just for more like individual projects and change and like the workplace or community level. Other than that, like I definitely agree with like change needs to be systematic as well. So like supporting and voting and educating yourself on those policies. But if you see more like something that you notice sparks your passion, like, man, I really don't like how my office produces a lot of this, or how we're always shipping our orders from here. Like find something that sparks interest in you, and also be open to listening to others' ideas. If there's one thing I've learned is like looking at history and how people have accomplished things can save you a lot of time and failure, because you can see what has worked in the past. And yeah, I guess that's just learning again. So learn, expand those neural pathways. Yeah.
Thank you so much. Yeah, great point. Knowledge is power for sure. And there's so much to learn. And then the more we learn, we realize that there's more to learn, et cetera, et cetera. Yeah, thank you all so much. If I may, I'd like to also just add a few points as well that are coming up just really quickly. So And this is across industries as well, right? Like for instance, for teaching, we have eco schools, and that's how I found out about that fundraiser where we can both where we can do a textile drive and also a fundraiser. So likely whichever industry that you're working in, there's some kind of association that you can join and learn from, where you get those solutions that are industry specific. And also for thinking about sustainability and our own ability to sustain action, we need to be taking care of our health. And unfortunately, for a lot of environmentalists and even healthcare workers that I know, I just see a lot of burnout, which is, and maybe a lack of time to exercise or meditate or even forgetting to drink enough water. So just the basics in terms of taking care of ourselves, so we can sustain our own action and our own mood as well, right? Like keeping optimistic, positive, things like that. So with that, we're going to go into our Q&A, but I'd like to lead a quick movement break. It's recommended to get a movement break in every half an hour. So we've already been sitting for more than that. Feel free to turn off your camera because I know it's kind of on the spot, but it's just like 30 seconds and I can lead it if you want to follow along. Our audience members too. So just even like hip rotations. So a good one is like joint rotation. So that can be your hips, it can be your shoulders. Remembering to breathe. Maybe you want to do a stretch, like stretch your arms up. Do whatever feels good for you. I do this in my classes. And yeah, maybe just shaking out a little. And yeah, wrist rolls are also good. All right, thank you so much.
So there's been some great questions posed in the chat, and I just want to make sure that we answer it all before folks have to leave. So the first one was based on what we were just talking about. There seems to be many great initiatives started by a lot of individual groups. How can these initiatives be collected and shared in one source rather than each group having to do their own research and own advocating to manufacturers and various levels of government? So we've shared some of the resources that we have, but happy to make a document of all of the resources that we've created today, and then maybe we can send it out with the recording later. Do any of the panelists have other thoughts about how initiatives can be collected and shared?
I think my suggestion for that, that's a great question, comes up a lot, is the easiest thing is just to join a group that already exists to avoid having to duplicate and reproduce things. And I think, yeah, lots of us have shared resources, and the websites of the places that we work at generally have a bunch as well.
I just had a thought, if I may chime in. I don't know if Tatiana, you wanted to talk about the family health team, because, me and Ariane faced the same issue as well. We wanted to start something new at MFP, and then we learned that somebody else is doing the same work, and things like centralizing it is both efficient, motivating, and there's a power number. So I don't know if you want to talk about how you were able to do that and give people advice.
We were really fortunate. We're part of the biggest family health team in Ontario. So it means that we talk to not only 160 plus physicians directly, plus a bunch of other family health teams, but we also have access to all these different partners, and thus we were able to spread a lot of change. I think it's a really difficult question though, because to the question's point, we have our own, here I'll share it, we have our own huge number of resources that we've created and put a lot of energy into, but you really do need, I think at some points, specific information for people in your area. So things like our municipal recycling system is going to be different. And so what people can actually recycle and what that guide looks like. We need it to be helpful, so we need it to be specific, and it needs to make sense for the area. And so it's hard to unify everything. But that being said, when we go higher up, kind of higher level thinking, things like MDIs, pointing to people who have already done things. So although maybe we're creating a new infographic with different information, we point to all of the other organizations that are doing that same work to spread that work a little bit more and to make it a bit more part of the public consciousness, or at least the consciousness of the people that we're interacting with.
I'd like to share another organization or another initiative. It's called Cascades, and it's an initiative out of the University of Toronto with 4 partners in total, including the Canadian Coalition for Green Healthcare. So I'm part of that, UBC and Dalhousie University as well. And part of what Cascades is going to be endeavoring to do is to create a pretty comprehensive website of information, case studies, infographics, a whole bunch of different things. So stay tuned. It's just getting off the ground, but it's going to be around for 5 years. So hopefully it will be of use to those of you looking for information on the healthcare side.
That sounds wonderful. Thank you. I hope we could compile all these lists for later and then disseminate to everyone. I'll just quickly touch on the next question. Linda and Edward, you did mention a little bit about this as well. Speaking of corporations, could we emulate them in some way to spread change the way some corporations spread new technologies or projects? Like we know Apple has a really successful spread of technology. Why are we lacking in environmental stuff? So maybe somebody can touch on how they're able to make, I don't know, larger impacts.
One of the things that Cascades will be doing is to identify initiatives that are happening and then spread them. That we want to be able to spread them across Canada. If there's something really neat happening, how do we spread it? And that's what will get us further ahead, I think, in terms of everybody helping out on this. Is the spreading. So as an example, the MDI thing, there's a core group of docs and organizations that are working on it. There's infographics being developed on it. There's a webinar that's coming up, and it's not just for Toronto. It is useful for everybody. So yeah, we need to be tuned into these things so that we know when things are happening that we can take part in.
If no other thoughts on that question, the next question is, what have been the most useful and most impactful tools or strategies to share information about practical greening solutions and to get people on board with taking action? Examples include social media, videos, documentaries, one-on-one chats, publications. So I guess this is more of a dissemination type question. What have been the most practical solutions?
I'm gonna backtrack a little bit and follow up on what Linda said. Totally agree that there's like a lot that can be learned from industry and also from behavioral science. So for example, RARE, R-A-R-E, is an organization that tries to use behavioral science to improve sustainability. They use, certain things like social influence, visibility, framing of issues, making ideas accessible. But what underlines the ability for corporations to influence thinking and behavior is capital, is a huge amount of money. And, that's probably a tool that is less accessible and is also a tool that may undermine the ends that we're trying to achieve. And so I like the question, I like that way of thinking, and I would point you towards some of the groups that have used strategies of marketing to try to promote environmentalism. So one of the the studies that really encapsulated that was in the US, where they an energy company provided a little nudge to people on their bills with a happy face or a sad face, depending on whether they were above or below a certain threshold of energy use. And they found that actually got people to change their behaviors a bit in terms of using less behavior. And it actually, these report cards kind of also told people what their neighbors were using, not their actual neighbor, but like an aggregate. And so those are the different techniques that I think, you know, might be helpful and that can be used on a micro scale, can be used in our clinics, in our neighborhoods. But I wouldn't try to take too many other lessons from Apple for the more structural things. And I'm so
Although
sorry.
I think, sorry, go ahead. I was just going to say that, you know, I think that investigating how they do manage to spread new technologies and projects is a worthwhile question, right? Like that, you know, for example, looking at the iPhone or Microsoft, you know, how is it that they manage to spread their new technologies or projects all across every desktop you probably want to buy? And, you know, I think the answer to that question, you know, obviously relates to capital, but also relates to power, which is obviously closely related. But, you know, if you're thinking about doing something like, okay, I want to create a circular economy, you know, you're not going to necessarily mimic a corporation to, you know, in its drive for accumulation or whatever. But I think it's going to be important to study, you know, why it is that, you know, we're in this place where all of our stuff has become disposable. Is it just because of, you know, concerns about infectious disease transmission or failure, or does profit figure into it somehow? You know, the right to repair for all of the different devices that live in the hospital or in your home, you know, that sort of is counter to the logic of the corporation as typically thought of. So I think that thinking about taking the perspective of a corporation may be helpful, but like Edward was saying, I'm not sure that we have the tools or the desire to do exactly as they do.
I think there is something to elevating the status of environmentalism. I can't take total credit for this one, but one of the students we hired recently, we give out artist-made plaques to everybody within our organization who does some of the work, and it is incredible how much that motivates people because they have a thing to say, you did it, you are better than other people for some reason. I think that the Apple metaphor almost works with that too, is because people really like buying things because of the status, right? Look at my new thing, look at my new object, right? So something that, I mean, again, we don't want to completely recreate that sort of dynamic, but what can we do that is maybe a little bit more environmentally friendly, that does elevate the status and from environmentalism and recognize people's efforts in a really external way?
Another kind of approach to this is the ability to improve networking between like-minded people. And there's some really great programs, software that has come out during COVID because we needed it, but something that could be used to actually get people to meet across the country who would normally not. And so some of these are like speed dating, or they're like coffee shops, can't remember the full name, but they're coffee something. And these get people together who have some like interests and can have a little chat, like a over the water cooler kind of thing, and move on to the next discussion. So these are some of the things that we're thinking of doing through the organizations that I'm helping, just to get people to discuss with one another, because I think that creates you know, lots of good sharing ideas.
That's amazing. Thank you, everyone. I think that sums up all the Q&A. So Sophie, I'll take it back to you.
I think we'll probably hand it over to Neil just to close out the night.
You're on mute, Neil.
Yeah, okay, I guess we'll start with the closing. Before I give some concluding remarks, really on behalf of our institute, I wanted Camille, who's been our conference organizer and event manager, to say a few things. So I'd like her to speak actually about Pegasus and what we tried to do in terms of even our last conference and involving Paintbox, and just how we might move as an organization. And then after that, she actually has another event that she's organizing in a couple of weeks that I asked if she might speak about too, and then I'll tell you a little bit more about Pegasus. But Camille, could you put yourself on video and just explain about your approach to our last conference and then the events that you have?
Sure. Sorry, I wasn't prepared to go on video, so apologize for my appearance. I'm in the midst of a home renovation. In terms of the last Pegasus conference in 2018 that we hosted, we did try to implement as many sustainable initiatives as we could within the conference. So for example, we didn't print handouts, programs, everything was done digitally as one initiative. I think one of the bigger initiatives we had was for the catering for the conference. We worked, as Neil mentioned, with an organization called Paintbox, and it's based out of Daniels Spectrum, so sort of Regent Park area of Toronto. A great catering company that employs community members, anyone who's looking to sort of get back on their feet, to reintegrate into society, everyone from delivery drivers to chefs, to servers, to sort of anyone working within the kitchen. They employ a lot of immigrants, newcomers to Canada, people who've been incarcerated previously, and again, getting back into community. Really affordable pricing as well. And another initiative we had was for the gala evening. We worked with the 519, which is another venue sort of in the Church Street area, supporting LGBT community. So all of the funds from that event went back to support that community. So lots of little things that we've done over the years within Pegasus to try to make our event more sustainable. I think just the nature of having an event, sometimes we know that they can be quite wasteful. So took some of those initiatives. And in terms of the event that Neil mentioned, and I will post here in the chat, complimentary pass code for everyone to be able to use. So I have 20 screens open. I'll just speak very briefly around an event that I've been working on for the last several months. It's coming up just after Thanksgiving. It is a 3-day event called Think 2030, and really focused around a lot of the initiatives that were talked about tonight. It will be a 3-day event. We are hosting in partnership with the United Nations, and really focus around how Canadians can take action around achieving the SDGs by 2030. We're 2021. When I sent the link to my husband, he's like, "Isn't this event in 2030? Why are you promoting it now? Do you really want to have that many people coming?" I said, well, we want to think about 2030 today, or there won't be a 2030. So really looking at how tech and innovation can be used to help us achieve some of the SDGs that are laid out. It is a 3-day event. Day 1, we're focused around equity and equality. Day 2 around sustainability and the environment. And day 3 is focused around mental wellness, mental health and well-being. In terms of our speakers, it is a virtual first event. So because of COVID, of course, we're looking to have 10,000 attendees. We are giving free tickets to anyone who's a student that registers using a student email. And then we do have complimentary passes for community members as well, and a very small in-person piece. That's sort of the agenda. We're having debate topics, spotlight sessions from corporates in terms of what impact they're doing and initiatives they're taking, breakout sessions, and then some really great featured keynotes. Our keynote speakers will be Emmanuel Acho, who's the host of a show called Uncomfortable Conversations with a Black Man, one of Oprah's best friends, Dr. Jane Goodall, Chris Hadfield, Jamila Jamil, Margaret Trudeau, and Jesse Wente will be our other speaker, and our 3 hosts are Tyrone Edwards, Chloe Wild, and Serene Fox. So looking to have really great conversations around the themes and as many of the SDG goals within the sessions as well. So I'll pause there, Neil. I don't know if there's any questions. As I mentioned, I will post a code in the chat for anyone who wants to attend. And once you register, all of the sessions will be recorded. So if you can't tune in for all 3 days, because I know that's a lot virtually, the sessions will be available on recording for 90 days after the event ends.
Yeah. No, I think, thank you, Camille. This is wonderful. And I think the panelists have all made positive comments about this. So it is nice to see a lot of people getting together, even if we might mistrust some people in power and their agenda. So it's nice to have you being part of Pegasus and being part of this other event. I wanted to say that my initial goal with something like this was just like highlighting stuff with the Green Office Toolkit and some local initiatives, and just thought we'd get a few people together. But I think that our 3 organizers, Sophia, Ariane, and Itai, they have been amazing. They've taken this much further and moved to more meta issues, the ones that those of us who've been involved in different events want to really reflect on. And I think that this time of reflection is really important. And as I was reflecting on our discussions today, I thought about the progression since I first got involved in things. I got involved with the Waterloo Citizens Recycling Committee. And so at that time, people in the early 90s were thinking of recycling. We were very much just past the consumption of the 60s to 80s. But people weren't thinking so much of the reduce side or the reuse side. And I think that people who had grown up in the war era, post-war era, and my family being a family of immigrants, those were actually things that people did naturally. And I did try to incorporate those in my medical practice. And so I do think that we moved ahead to thinking about those probably in the early 2000s a little bit. When we produced our Green Office Toolkit, the first time we actually worked with a medical student, Lisa Mu, who developed something for the Ontario College of Family Physicians, CAPE, and the BC Medical Association, many other groups. And once again, we had something that was good. We focused a lot on the biophysical. And I think that our toolkit from 2018, Linda and a few of us were authors of that, that we were focused on the biophysical environment primarily there. And it's nice to see how with our panelists here, and we see that they're not just speaking words, but they're living this in terms of thinking about the socioeconomic, political, and thinking about those who are more marginalized. And we didn't talk so much about it here, but you got that in passing, that people are doing that. And I saw that as being very positive. And Pegasus seeks to really unite some of the people concerned about both things, because if you tell people to eat green, organic vegetables, and meanwhile, the carbohydrates are the much more of the affordable type of diet, I don't think it's really fair. In the same way as we talk about, oh, well, now China and other countries like India, they've got great emissions and they should reduce, without thinking about our consumption and equity. I think it's important that we move that dialogue. But I think you guys have even moved that further to a way that we need to be in terms of the caring and sharing economies. And so I've really appreciated how you've tried to share these approaches, and I hope that we can continue to engage with each and every one of you. I think that this is really all the time that we have today. So I really do want to thank you as experts for being part of us. but and the audience, even though it may seem small now, especially those who are left, but we actually get a lot of traffic after. And I think that this is part of the post-pandemic ways that we're going to have to organize events. Some people want to be part of things in real time, but we'll have many more people engaging with us afterwards. So I really appreciate the reflections you've shared. I appreciate the comments from those who've attended, and would like to thank everybody for being with us. I want people to watch their emails, those who are on our listserv, for coming events. Our next event with Pegasus is related to COVID vaccine access equity. And we'll have people from Latin America, from the Solomon Islands, some Canadians involved with advocacy, including medical students, and the chief scientist of the World Health Organization, Soumya Swaminathan. So it promises to be a great event. It's 2 p.m. on the 19th. So I hope that you're able to join us and suggest ways also in terms of how we can do better as Pegasus. So thank you all. I encourage you all to stay healthy, stay safe, and of course, take care of each other and ourselves. Bye for now.
Thank you. Thanks, everyone.
Bye.
Thanks.
Okay, everyone.